Hospitals across America focused on people who have developed COVID-19. Some people with unrelated but still urgent health problems feeling maybe a little bit awkward about going to the emergency room.
But people with serious symptoms shouldn't ignore them, especially if you're suffering from a heart attack or a stroke. Jean Lesarge-Bono, Executive Director of American Heart Association West Michigan, joining us to explain how to seek help in this strange time. Good morning. Good to see you.
Good morning. Good to see you too.
We've been having these conversations about what do you do if you don't have anything related to COVID-19 or the coronavirus, and do you feel safe enough or to go to an emergency room?
Yeah, and the American Heart Association is really urging people that if you have early warning signs and symptoms of a heart attack or a stroke, that you don't avoid seeking the emergency rooms. The emergency rooms are really set up to be able to treat people who are exhibiting urgent kind of symptoms, and we really urge people that do that.
I guess, what are some of the warning signs people should be looking out for? And I can imagine it's only a little bit more of a stressful time for folks.
Yeah, it can really be an increased stressful time for people as well. So the warning signs and symptoms you want to look for is that pressure in your chest. If you're feeling pain in your chest or pressure where it feels like it's squeezing, or the description of an elephant sitting on your chest, you need to seek treatment. If you've got pain that's going down your arm, you've got jaw pain. Women may experience symptoms that are slightly different than men. They may not experience the traditional chest pressure or that pain going down the one arm. Women may experience nausea. They may experience vomiting. They may experience fatigue, extreme fatigue, or jaw pain. And again, pay attention to what your gut instinct is telling you. If you think that's not right or something else is going on, we urge you to seek treatment at the emergency rooms.
Yeah, I think so many times you have a little twinge or a little this or a little that, and you just kind of blow it off, but certainly not the way to go.
No, especially in these times. I know that people are avoiding seeking the emergency departments, but they really are trained to react in the event of an emergency. And most of them are treating the respiratory issues in a separate area. So if you've got the early warning signs and symptoms, stroke, it may be that you've got some of the asymmetry going on with your face. It may be that you've got some arm tingling or numbness. And we just encourage you that if you've got any of those warning signs and symptoms, speech difficulty, that you're seeking treatment at your emergency department. It can really ensure that you have a better outcome, and it can even save your life. Cardiovascular disease remains the #1 health risk.
And we appreciate that so much. Very wise words here. Thank you again for joining us this morning.
Thank you.